Welcome to the Heart of Healthcare podcast. I'm Hallie Tecco.
I'm Michael Esquivel.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all.
Hello, listeners, and welcome back to a Heart of Healthcare podcast. I'm Steve Krause, and today I'm talking to my friend Aneesh Chopra, one of the leading minds when it comes to healthcare policy and innovation and entrepreneurship. And as we sit here in the aftermath of one of the most consequential elections in American history, I'm so excited to talk to Aneesh about the outcome of the election, how we got here, and where he thinks we'll be going as it relates to healthcare policy and innovation under a Trump administration. But first, let me give you a little background on Aneesh. He served as the first Chief Technology Officer of the United States under the Obama administration and served for about 4 years in the White House. Before that, he was Virginia's Secretary of Technology and actually a candidate for the 2013 Democratic nomination for Lieutenant Governor of Virginia. So he's both been a policy mastermind in the federal government. He's run for office himself. He's also the author of The Innovative State, How New Technologies Can Transform Our Government. And he's a co-founder of a very interesting value-based care analytics company called Care Journey. So as you can see, this is a man who's crossed multiple dimensions within healthcare policy, healthcare innovation, healthcare entrepreneurship. Aneesh, welcome to A Heart of Healthcare. I can't wait to talk today.
Wow, that was a very kind introduction. So thank you for all of that.
Well, it's well-deserved. All right, Aneesh, we have to start. The election. You've run for politics. You've served in government. Yeah. Obviously, a really transformative moment in U.S. political history. What do you make of it? How did we get here? What did you learn from this election?
Well, let me start by saying, obviously on a personal note, this was not the path I would have hoped for our country. That's okay. The country's big and we have lots of diverse views. It comes down to the basics. The surveys that came out made it very clear that the economy was the issue we heard throughout the campaign.
It's the economy is stupid.
I hate to say it. And in many ways, if you kind of look at it even more granularly, it's basically the price of groceries. If you look at the index of what it's like to live a daily life in the country, you could see a pretty significant growth in the last 3-4 years. And, the president-elect played right into that as his main message, and that worked. I would say a lot of the other broader issues about inspiring women to exercise their rights in the voting booth to reflect their personal rights. I think you and Hallie have talked about that a little bit on previous episodes. Maybe that did not have as much of an effect in the underlying outcome. And obviously some of the concerns about the threat to democracy didn't clearly land. And frankly, honestly, we're on a podcast today, Steve. I might say that one of the reasons for that is the long-form podcast may be the quiet story of the election to dissuade
Joe Rogan,
people.
Yeah,
because if you listen to those podcasts, you're like, okay, Trump is Hitler. Well, wait a minute. No, he's not. He sounds pretty reasonable. And when you kind of diffuse the threat to democracy bomb and you get back to your pocketbook and where do you want the country to go? Is it right direction, wrong direction? You can explain some of the results that we're seeing. There is something to be said about this pollster versus the prediction markets question. The provocateur would say the prediction markets were more accurate than the polling, and that may be a discussion for another day. But yes, it's definitely an area where if they run the trifecta, the House, the Senate, and the White House with the mandate, the truth of the matter is there's a lot of opportunity to bring about change, and we're all going to be reflecting on what the president's top priorities will be to bring about that change.
Before we go to the impact on healthcare policy, which I want to talk with you specifically about today, you're a Democrat. I'm a Democrat. Let's be open about who we are. What do the Democrats do to rebuild from here in your mind?
Well, I think we have to take a bit of a soul searching on how we communicate what it is that we do that will help people in their daily lives and focus less on these divisive issues and fear tactics to some degree and other causes that may be secondary or tertiary to their fundamentals. And the ability to communicate on what we can do to help people live better lives, I think is the big miss. It's a communications breakdown. I'd like to think that we had the right package of policies. There could clearly be a discussion about whether we learn a little bit more on ways to boost economic growth. But generally speaking, it seems like it's a communication breakdown more than anything else. If you asked people, how would the vice president help you in your personal life from an economic standpoint, hard to see their answers to those questions is giving us confidence that communications was working.
Very interesting. Thanks for the analysis. Let's turn to healthcare. Curious, before we start talking about winners and losers when it comes to various sectors, policy starts from people, right? And one of the first key things that a president-elect and transition team has to do is think about who's going to be running the agencies. Who would you think about leading the key health agencies? Who would be an ideal candidate in your mind from that perspective?
Well, ideal is a complicated word because it's not my choice. But if I were to suggest, if I were in their shoes, they have there's a perspective, which is that experience may or may not be a valued asset. So you can see an Eric Hargan, who was deputy secretary, playing a administrative role again. You could see likely not an Azar role in HHS, but probably someone that has had experience. Bobby Jindal may be an option in that example, had been assistant secretary, was governor. You might think about, more of a change agent or an entrepreneur. Maybe, I wouldn't say Brad Smith for secretary, but you could imagine maybe someone who has that kind of background. Probably another option is Seema did a terrific job as CMS administrator.
Yep.
And you could easily make the case that she'd be a wonderful HHS secretary. So, but let me just say at the outset, CMS and FDA operate not, I wouldn't say independent of the HHS secretary, but the nature of the way that agency is run, it's not like that person has fiat over the CDC, FDA, and CMS. They do operate quite independently, and I'd add NIH to that list. So it may be just as important to speculate on who's going to take the seats in each of those sub-roles.
If you're a betting man, do you think the administration goes with someone who has experience in public service, or do you think they go with someone who's total outsider?
I think the president's going to prefer outsiders as advisors to him in the White House apparatus. Who actually gets Senate confirmed in agency seats? That may be a little bit of a jump ball. I don't know enough about Project 2025's reality. I think the distancing that we saw during the campaign may not reflect the reality, which is that there's already a long list of resumes collected that will be filling in those political appointment slots in the agencies. So it could be a more ideological staff where the person that's in the cabinet position may not have all the control over the full kind of employment stack in the agency. So I don't know. There's a lot of unknowns. But let's just speculate if it was a Bobby Jindal type, you might see a lot of the traditional Republican policies come to fruition. You might see not block granting Medicaid, maybe not explicitly, but some version of more state control, right? Yep. Laboratories of democracy. I don't think you'll see a lot of expansion of health equity to be charitable. It may actually be constrained. The experiments in certain states that are trying to cover some of those, the cost of food and housing and transportation benefits inside the healthcare chassis. That's probably not for the long term in this administration. So it may require a lot more. The social safety net's going to be under a lot of pressure. And I'm really curious to see what he does with the ACA.
Yeah. I'm curious about that. Let's stay there for a second. But that's been such a political ball that has been thrown in the air many times, right? And I think very few of us would have realized how it weathered the storm, number one, and how it come out on the other side, at least as we stand here today, stronger than ever, more people enrolled than ever. And yet there's a chance that if it is president-elect, we know the Senate's going to be Republican, and there's the House turns Republican in the next few days, right, or has Republican control. Will they go after it again is the big question. Is this something that's political suicide now, or is this something that you think could be a reality?
Well, let me frame it in positive terms, Steve, because I think there's a lot of concern that we're going to lose access. So let me acknowledge that concern, but let me share what I think are on the margins 3 likely areas of focus. Let me start with technical, because this is a little bit of my passion.
You're a wonk.
Well, Georgia, right at the end of the Trump administration, said we want to create a state marketplace, but we don't want to brand it Healthcare.gov.
Right.
We want a completely private sector network of marketplaces.
Yeah, one of our companies, actually, best member companies, powers that, called Get Insured. Exactly. Right.
Okay.
Yeah.
So in that, well, Get Insured got that contract. So let's assume that there is a world where Healthcare.gov, the domain, is removed from the internet, but that we have this essentially privatized marketplace with guardrails that allow for some interesting innovations to say, hey, let me bring AI-powered decision support to your benefit selection. There's a lot of things that happen today where the government websites are limited to what they can do. They can be dumb pipes to communicate raw information. And as many economists point out, we make bad decisions in something as complicated as health insurance. So the positive could be it unleashes a range of AI decision support in plan selection and maybe some creativity around the whole customer acquisition. A lot of people still qualify for tax credits that haven't availed themselves of it. So even before we expand new classes of people getting access, you could see more innovative and creative ways to recruit people.
So your idea is that the Republicans might not immediately destroy the ACA on this example. They might actually try to bring in more innovative solutions to improve the ACA. This is what you're potentially positing.
Let's call that chapter 1, which is like a modernization.
Yep.
Where you can declare victory by literally killing Healthcare.gov, but you're really enabling more of a marketplace of standardized benefit designs.
Interesting.
Right?
So you get the soundbite that we destroyed Healthcare.gov. We finally took it down, but you still have the coverage for Americans.
Let's say, for the sake of discussion, that's one area, only because they did have an example where that was a waiver approved, and so that that idea happens. The second area, I think another bullish area, is the ICRAs.
Yep.
So
can you explain to our listeners what those are just quickly?
Many people say, what is the biggest mistake we made in healthcare going back 50, 75 years? And this idea that we're going to do pre-tax benefits, right, with the employment arrangements, and that if you were to buy insurance on your own, it's post-tax. It's sort of like we've got this tax arbitrage that drives us towards a fragmented, broken system. So we're not going to solve that problem by eliminating the tax advantage, but we could create parity,
right, that
the employer could offer you a coupon to shop on your marketplace with pre-tax dollars. The ICRAs are basically the accounts that you would choose to, the employer is contributing, so they're going to pay a portion, but I get to use those dollars to shop pre-tax.
Yep.
This is an area, I don't know if you would call it Republican or Democratic. This is in part what I thought was in the ACA. Like if you were to say, like, the ACA is like mom and apple pie. If you're a reformer of the healthcare system, there is a sentence in the ACA that gives you hope because everything is in there.
Right.
Okay. It's just what's the priority and how do you make it work? So did the IRS say that you could offer pre-tax benefits in their implementation guidance of the ACA? Well, in the Obama administration, it was like kind of no. And in the Trump administration, they said, well, kind of yes, under these rules. So that doesn't require congressional action, but it could be the case that we ask the question, should people have the freedom to shop for their own plans? And in a world of really AI-powered everything, the network I want for my family, Steve, might be different than the network you want for your family.
And for sure, it's probably different than the network that the CEO, if you're a working class person, that the CEO of name huge corporation wants for their family. Yeah.
And if they're actuarially equivalent,
right,
that I should be able to have my cake and eat it too.
Right.
So there is a bullish case that we go harder on the individual freedom to shop.
Which, by the way, there's a predicate for this already in Medicare Advantage, right? And, if we want to, one of the forces we need to bring into the healthcare ecosystem, I believe, is consumers, right? Because the consumers have driven, improvements in every other economy.
And as I will spend some time today, my dream is of a health information fiduciary that's consumer focused, that helps me make every decision I have in front of me as I care for my family. So let's take that as the second topic. Now, those are two what I would call not bad reforms, okay? The third one is the bad reform, which is we're going to probably see an end or a reduction in the enhanced subsidies.
Yep.
Now, here's the part that I'm really curious about. This may be less about an ACA decision and more about the Trump tax cut reauthorizations in 2025. because
meaning they use the getting rid of the subsidies to fund the tax cuts reauthorization.
In a way, so right. So here's the let me play a little bit of let's play this scenario out. Obviously, the president's going to want to reauthorize the tax cuts. He might even want to go harder on tax cuts. He said that in the campaign. So now the question is, how religious is Congress on having pay-fors?
Meaning, explain a pay-for, Aneesh, so people understand.
In Washington, we are ostensibly trying to balance our budget to be fiscally responsible. And so there's been this notion that when we introduce new programs that cost money, that we have cost savings or revenue enhancements that offset, so we are properly introducing capabilities through the government that are resourced. And what is the typical Washington parlor game is that when there is a tax cut, like the Bush tax cuts in the Obama years, and you're up for the reauthorization of those tax cuts, that's where you have the opportunity to either bring in fiscal discipline or, as is the case over the last many years, a mutual agreement across both parties to just balloon the deficit, and you get your candy, I get my candy, and we move forward with collective candy. So here, I think the question is, A, Trump tax cuts happen. B, does Congress care about a pay-for?
Got it.
C, if yes, what are the highest likely candidates for the pay-for?
Yep.
And on the table, the ACA enhanced subsidies is definitely available to take away, and there's nothing to put back in. It's just like it was something that was added during the pandemic, and it's going to be removed. That's one path. The other is Medicare Advantage overpayments. Like, where do you put the $90 billion estimated MedPAC overpayments in MA? Do those get folded in as a pay-for? And I think there's probably more to be said about Medicare Advantage in a pay-for environment. ACA subsidies and all the other investment questions are largely going to be consolidated around the Trump reauthorization process.
Really appreciate it. So I do want to move on to other areas. That was a masterful, detailed analysis of what pros and cons. And I appreciate, even though you declared your partisan loyalties, you also took an optimistic view. Let me posit this question. Any chance ACA gets repealed?
No.
You don't think it's politically feasible?
I don't think it's even wanted. I think it's probably ACA reform.
Yep. Okay.
Less regulatory centralization, more freedom for the states to do religious healthcare cooperatives and have that be a qualified plan. But the basic architecture of the ACA kind of works. It's just that depending on the priorities of the administration, it has the ability to kind of emphasize more of your values through a centralization vehicle if you're a Democrat, and maybe more flexibility and innovation if you're on the right.
Okay, let's stick with a part of the ACA, which was the value-based care movement. I have a couple other topics I want to talk about. VBC,
Yes.
what's your view on this as we head forward into the new administration?
Well, the headline is VBC bullish, right? VBC has been, it's ironic, I will say, now there's a chance for me to sort of maybe share my frustrations about my own people here. VBC had been bipartisan. If you remember, when Trump inherited the Obama VBC models in the Medicare Innovation Center, to my knowledge, every single one of them went forward.
Yep. I think that's
They
right.
added, they tweaked, they did whatever, but they didn't kill the social determinants of health model, the accountable health communities model. They could have. That went live, I think, in the last year of Obama, maybe 15. So, there's no reason why they couldn't have stopped things that maybe that was health equity oriented, maybe that wasn't a big deal, whatever. When Biden came in, who attacked value-based care? The progressive left.
Yeah.
Said, hey, we hate MA, privatization of healthcare, profiteering, and oh, by the way, the signature reform, direct contracting, that is a wolf in sheep's clothing. So it was the progressive left that was hammering the Biden administration to cancel the direct contracting model. Poor Liz Fowler was called up to Congress and they were, how dare you? And this is all, you're just maybe giving Aetna and Humana and United all this money. And but wait a minute, these are physician networks. This is doctor-led networks. And so that was just lost in the discussion. So unfortunately, it was the Biden administration that canceled Trump models. And the one that I was most excited about was the geographic direct contracting model. Because if you wanted to make a real serious dent, lock in savings and truly improve quality, if you could take New Orleans, or there were like 7 or 8 cities that were in the nomination pool, and said, hey, we're going to you could stay in fee for service. You all don't have to rush into MA. You could stay in fee for service, and we're going to build a truly coordinated program regardless of who your doctors are. Keep your doctor, right? But we're going to wrap care management, care coordination, understanding your disease. That was killed because it was seen as like some big MA thing. And it wasn't. Right. It was actually the opposite. It was like, don't have to go to MA, stay in fee for service, but have the benefits of care coordination. So anyway, I was upset that we did that. VBC, obviously the workhorse of VBC is the Medicare Shared Savings Program, the little engine that continues to put points on the board.
I know.
Right?
Yeah.
It's working.
We talked about it last podcast. It's pretty impressive.
Yeah. Farzad, our brother, has done a phenomenal job explaining to people. He open sources everything, by the way. Love Farzad for all. I love him personally, love him professionally, right? So the point is that program obviously stays. There's 0.000 risk to that program. The issue is, what do we do with the Innovation Center? And here, I think there's a healthy debate. Do we let 1,000 flowers bloom, or do we pick a few and run deep?
Yep.
My bias, I think the Trump administration's likely going to pick someone that's going to pick a few and run deep.
Okay.
And maybe geographic DCE comes back.
Love it. Let's switch to Medicare and Medicaid, right?
Yes.
Let's move a week earlier, and Medicare MA, Medicare Advantage, which has been honestly a huge profit center for a lot of companies.
Correct.
And frankly, has been a place where a lot of investment has flowed to over the last decade.
Right.
Recently, it's fallen on some real serious troubles. Troubles financially, serious troubles in terms of outcomes, serious troubles in terms of some aberrant behavior that you've noted, right?
Correct.
On the other hand, Medicaid, which has long been viewed as few private companies focused there, Centene, Molina, a few others. But, honestly, unfortunately for that population, ignored for a long time, for the decade prior. But recently, Medicaid has gotten a lot of innovation in it, a lot of interesting companies, a lot of investment. Now we have this election, and I'm curious your view. Do things change? Does MA come back in favor because clearly it's something Republicans like? Does Medicaid get hit because, frankly, it's not necessarily their voter group, although maybe that's changed from some of the recent demographic changes in voting? I'm curious what you think. Yeah,
it's a yes, yes, and yes. So here's it's good, bad, and maybe ugly. So it's one of those weird things. So I believe Senator Cassidy has made it clear he ain't happy with the Medicare Advantage upcoding dynamics, right? And first of all, mad respect for Senator Cassidy, right? He's I don't have the same political views, obviously, but as a professional, thoughtful health policy leader, you appreciate when both sides of the aisle have voices that come to this with data-driven thinking, and I give him credit. Of course, my personal hero is Senator Mark Warner and Tim Kaine. So there's some great people on the Hill. The point I'm getting at is MA may not be a free-for-all, but it is definitely the preferred path for making the changes we need in healthcare. So it's going to be likely a mend it type dynamic, not end it. The premise is I think you'll see a lot more tightening. Again, back to the question of overpayments as a pay for in the reauthorization for taxpayers. I think we go long MA, but we go long not on V28 goes back to V24, but that we go long clinical transformation, not risk adjustment optimization.
So you think the changes in risk adjustment stay?
Yeah.
And what do you mean by clinical transformation?
Well, you got to actually bend the cost curve. Like, what does Farzad do? Does Farzad upcode in Medicare Shared Savings? And I don't mean to call out him, but metaphorically, those networks have to actually bend the cost curve. Medicaid is an area where I think there's an interesting opportunity. To me, Republicans are very much believers in laboratories of democracy. So states will have flexibility to tackle this issue. And there isn't a governor in the country that wouldn't want more control over this, what is essentially the single biggest line item in a state budget.
It's the single biggest liability that will bankrupt the state. Yeah, for sure.
So then the question is, what are the creative solutions? MCO or not MCO is kind of like that decision's made. Expansion or not expansion, I think that decision's been made. We're gonna do expansion and we're gonna do MCOs basically. Now the question is, what are the VBC product opportunities? Duals, high on the list. Substance abuse and mental health that are, within patient admissions, that's going to be another category. Moms, I wouldn't call that risk, but I would say we want to do more to improve maternal mortality.
Yeah, NICU. Yeah. Chronic kidney disease, obviously huge.
So as you look at Medicaid being 5 or 7 VBC verticals inside it, you could make a bold case that certain states are going to go hard in some areas and not others, but you would not be down. You would be up on creativity and innovation. And so I think this is actually going to be positive on the overall value-based care movement. It'll hopefully be skewing the incentives to more of the good and constrain against some of the excess.
Last major topic I want to talk about is women's health. Obviously, Dobbs. I don't think there's a way to put a positive spin on that one. Hugely consequential decision in our country, especially for women and women's rights to choose. Clearly, in the election, there was a lot of talk of if Trump and Vance are elected, there'll potentially be a national abortion ban. Yeah. Clearly, if we have a Republican House and Republican Senate, they have a mandate. What's your view? Is that a possibility, or you think that's DOA?
To me, I observe that the Trump administration is going to pick a few key bets that they're going to go hard at because they care deeply about it. You'll see that in immigration. You'll see that in tariffs and sort of international affairs, foreign wars. I don't think they're going to kowtow to the House that may be excited about a national abortion ban, because they might propose one. I think this administration kiboshes it and says, sorry, folks, these are my coattails. I ran on not doing the national abortion ban. And if you listen to Trump in all his long form podcasts, he makes it very clear. I gave it to the states, and the states are voting. Even his home state of Florida, while it didn't meet the magical 60% threshold, 57% in a state that was plus 12 Trump. He's got the message that he did his part, if that's what he's thinking, and the American people are saying what they want. And my guess is, in a weird way, we'll go back to Bill Clinton, safe and rare, right? That's kind of the goal, I think, is where we're going to probably compromise as a country. I do hope that the last few states that have these ridiculous 6-week bans, which includes Florida, Nebraska, I think we will hopefully see more action in those states to fix that in the coming years. But I think this issue is not going to be, I hope, further deteriorated. And for my loved ones, for our loved ones, I certainly hope that that's true.
I want to have a few quick final lightning round questions, but any other topic we didn't talk on, major topic you think we should note of coming out of this election when it comes to healthcare?
Well, we didn't talk at all about interoperability, which is my life's passion. And that's okay, because we don't have to. Just to remind the audience, bipartisan.
Yep.
It was Bush, then Obama, right? Trump, Biden. We've had one consistent theme.
You've even gotten the big closed source companies, Oracle, Cerner, and Epic, to sign on to TEFCA. So I think you've won.
Nothing is certain, but nouns and verbs, right? So TEFCA might change, Steve.
Of course.
Maybe the agreement details may change, but the idea that we are on an open chassis, I think, is done. And now we got to start getting people to access and use it.
Yeah, 100%. Well done, by the way. That's a huge, but to get Epic to open their gates and sign on, you should take a lot of pride in that.
To be very clear, I give all the credit to Mickey Tripathi, who's made this his personal passion. And so I don't know if the next administrator is going to be as passionate, but I think we are on the path that now it's like an inevitability that we've got.
Well, if you listen to the podcast, which I know you have, we've talked a lot about this interoperability. So I'm happy for you, and I'm happy for our space. It's really important, because every other modern tech industry has it. Hey, lightning round questions.
Yes.
RFK, any chance he's in the administration?
Yes.
Yes.
He's already in the administration. The question is, what will he do? Short answer, I hope at a minimum he will allow us to see greater transparency. So I hope he won't impose his will on the country, i.e. vaccines and all the rest. But
all if he creates stuff.
Well, but if he gets more transparency, he may result in greater confidence in the system. So if RFK in, and what would he do? What's his legacy? Transparency may be the biggest opportunity.
As long as it's science-based driven,
That's
I
right.
hope.
Science-based transparency. That's the hope. We can only hope. We can only hope.
And by the way, I'd say that a lot of his ideas are totally wacky, but his focus on health and some of the things he's promoting that aren't therapeutic in nature or drug regimen nature aren't bad ideas. So I don't know. I'm scared, but I hope some of that they take good out of. Biggest winner from Tuesday's in the healthcare ecosystem. Biggest winner from Tuesday's election.
I hate to say United.
Oh, no.
I don't want to say United.
They're the one that it doesn't matter what administration.
I don't want to say that. But I don't know. It feels like it because I feel like they've been in the bullseye here with all. I mean, by the way, through no happiness of their own. Like they've walked themselves into mistakes. They've stepped in it pretty hard. But I feel like the pressure may be slightly less intense today than yesterday.
Well, surely there's going to be less scrutiny on M&A from the FTC, right?
Correct.
Mean, that's obviously, and they've been a master at that in our ecosystem.
Correct.
Which, by the way, isn't necessarily a bad thing. For our innovative companies, having more people be able to acquire them isn't always a bad thing, as long as the actual product isn't killed.
I am only hopeful that while we release the pressure on, and I'm saying United, but say broadly, J.D. Vance is passionate about competition in markets. So we don't know what the vice president will pick as his or her portfolio, but if he picks competition, then maybe there is an area that is a little bit of release the pressure, but don't lose sight of the fact that if you objectively look at the data, the provider M&A and the payer M&A, forget the IT consolidation through these chassis, it's not clear we've gotten great results as a country here.
I think that's
I'm trying to be charitable here. I'm trying to be kind, but yes.
Biggest loser from Tuesday's election in our ecosystem.
I hate to say SDOH because that's something that I feel like is an area.
Social determinants of health for our listeners. Yeah.
The issue here that says that you understand the patient's total health need and you tackle the needs that matter, that have the highest impact on their overall health. The experiment we've started may not be well underwritten as we proceed. So I think the health equity and the SDOH priority may lose a little bit of the luster.
That's a bummer. Biggest hope when it comes to our industry for the next 4 years under this administration?
Well, the ultimate hope is that healthcare inflation falls to GDP +1, ideally GDP flat, in which case innovation helps us reduce the total cost of care, as opposed to, the next balanced budget act of whatever the year is that's going to require the next provider rate slashing. I was at Sanford Health does a Future of Rural Summit, and Senator John Thune was in the audience, and they're like, "Hey, man, you're going to fight for us? You're going to make sure that we have access to a fee schedule that's right?" He goes, "I give you a couple of years, but you better get your house in order, because the idea that we're going to keep underwriting health inflation, I don't have much more tolerance for this," is the message that I heard pretty clearly, and we'll see where he is on the leadership for the Senate.
Yeah.
But I do think that, in the next 4 years, if we could demonstrate that innovation leads to a bending of the curve that we can bet on in the CBO, I think that's the hopeful pitch.
Well, Aneesh, this has been amazing. You're brilliant. I appreciate you're also bipartisan. You're hopeful, and this is just a tour de force for our listeners coming out of what I think a lot of people are searching for. Optimism and hope, and frankly, a way forward. So half of our country clearly has it. Half of our country doesn't have it. But I think in this podcast, for our listeners who care deeply about healthcare, I think you painted a path, hopefully, that we can achieve over the next 4 years. I really appreciate you coming on in such short notice and giving us an overview of your view on the state of Tuesday's election. Thanks, my friend.
I appreciate your friendship, brother. Thank you.
You too.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review, and don't forget to subscribe. The Heart of Healthcare is produced by Hallie Tecco and hosted by Michael Esquivel, Steve Krause, and Hallie Tecco. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and details.